Hey everyone, welcome. I think we could probably steal an extra minute if that sounds good, and we can just jump in. But shout out to all of you guys for being here. We appreciate it, especially when we only have so many days in Arizona, and we know this is your precious time. So we appreciate you coming and joining us for our talk called Shifts, Scholarships, and Stuffed Animals. And this feels very loud, so I will slide it back a teeny bit. Okay. So we have no disclosures to give, but really our objectives today are really a couple things. So we're going to talk about the challenges that we kind of face, and I think all of us in this room are experts of our own lives and experiences, so we definitely want you to make this interactive as well too. But we'll talk about kind of leadership and the clinical realm, kind of the demands on our lives that we kind of see in all the different aspects. We're also going to kind of facilitate some storytelling and share kind of our own framing of the problems that are there, and also how you can find joy in those situations. And then really just in the lens of being, all of us are physician moms, that we really want to share just some solutions and strategies that you can apply to your own life. And we do want to give a disclaimer, though, that this talk itself, while we say it's, physician moms finding joy, we don't want to undermine kind of the harsh realities that exist outside of these walls. We know that it is hard. And despite how far that we've traveled as women in medicine, there's still such a big road that we still have to go to actually make a difference and kind of close those gaps that we see in promotion and so on. So, and then we also just want to say that this is kind of our own perspectives of our individual lives. So we'll give you solutions that are kind of tailored for our own different life experiences, and you'll see that we all live different lives and approach things differently too. So hopefully some of that might resonate with you as we're going through. And then just again, we know that sometimes, the job descriptions we have, the lives we live outside the hospital, there's a lot of intersectionality that happens there. And so just know that the challenges, your challenges may be a little bit different than ours, but hopefully we'll find some things that resonate for all of us that we can kind of build together. So we're going to introduce our panelists here, but I'll be the moderator today. I'm Serena Dation. I'm one of the Associate Program Directors at Duke. I've been there for finishing 11 years, so 12 years feels like a lifetime. And we know in academics, it speeds by really fast, so it's kind of weird to say that. And I'm clinical faculty. I also work in the medical school. I help with the longitudinal program on the SIM director for the MS1s, and then I also teach MS2s as well. And then I work on the GME as the Professional Development Executive Committee. And so I've started a medical education leadership track at the GME level for both residents as well as faculty as well. So lots of stuff going on. And then we'll have our panelists here kind of introduce themselves.
Hi, everyone. I'm Sophie. I work with Sri at Duke also. I came there 8 years ago to do Global Health Fellowship. I did research in Tanzania on hypertension for my fellowship. I continue to do that. I also teach 2 classes in the medical school, one for students just when they first start and when they're about to graduate. And I recently started a project looking at disparities in hypertension care in our local community.
Hello, everybody. I'm Mary Haas. I am at the University of Michigan. I was an assistant residency director for 5 years, and shout out to my advisee in the crowd. And I transitioned out last year to become the medical education fellowship director. I also do some work with faculty development for our department, and I teach in the doctoring course at the medical school and also run the leadership development program for the medical school. And I have 2 children and a third on the way, and my husband is also an emergency physician, so that's kind of the uniqueness of my particular situation.
Hi, everyone. My name is Adara Landry. I'm an emergency medicine physician at the Brigham. I've been there for about 8 years. I've had various positions. I've been an assistant residency director, a fellowship director, and now I am an advisor for the medical school. And when I'm not working clinically and advising students, I love to write. So I'm a contributor for Forbes magazine, and I do a lot of writing for Teen Vogue, as well as other outlets that are more business workplace oriented. And then I just finished my first debut book with HarperCollins called Microskills. So I spend a lot of time writing. And then when I'm not writing myself, I have a nonprofit that is focused on teaching people how to write. And I have 3 children.
Awesome. And I want to ask you guys a question. So why do you stay in academics? We'll just kind of start with that first question before I do the next slide. But what is it that keeps you in academics? So we'll talk about some of the challenges and the barriers and stuff too. But I think starting the foundation, we have a choice, right? Community, academics. So what drew you to academics and why are you here?
I'll start. I love being around people who have a growth mindset and people who are trying to find solutions. Not that folks in the community aren't, but I just love the idea of finding a question, studying it, looking for solutions, and being around people who are like up and coming within their career.
I really enjoy doing different things. So I love teaching. I love working clinically. I'm mostly a clinician, and I like teaching while I'm on shift and doing research. So it's the only job that lets me do all those things simultaneously.
I would say just the social piece of it is very inviting to me. And part of my personal mission and vision is to bring people together in terms of communities and collaboration. And academia definitely allows me to do that. And then secondarily, I mean, it does give me flexibility with my schedule because, you know, a significant chunk of my time is spent doing education and administration, which is a little more flexible in terms of when I can do it versus a clinical shift that's more set in stone. And I find for me, that cognitive switching of different parts of my brain to think about different kinds of things in different ways to actually be like particularly protective against burnout, even though we know academia can also contribute to burnout. But
Awesome. Yeah, and definitely I think that they have found like academics, there's a lower burnout rate, right? Because we get to see and be part of someone's journey as they're going through. We get to see them terrified as a med student, right? About asking questions and even like touching the patient. Sometimes they'll go in an interview and never even touch the patient, right? Because they're terrified. And then we get to see them at the end of the residency, right? Saving people's lives. And I always like to like pause and make the residents after we like stabilize the patient, of course, right? And make sure they're okay and they're on the way up to the ICU to just stop and say like, hey, if you weren't in that room, that patient would have died. Right, and just let them sit with that for just a second to say the things that become so ordinary that we do every single day without fail, no one else can actually do that. No one else can actually walk into that room and do it with the same kind of efficiency and skills. And even as attendings, right, all of us, we kind of take that for granted as that skill as well too. So that's kind of things that we can kind of help uplift each other and remember. But outside of the academic world, this is our lives actually, 24/7, 365, even though we try to hide away in our car maybe for 20 minutes before going inside after a shift. Unfortunately, this is still the reality of it, right? Is that as soon as you're back inside the house, you're on again, right? And there's little people that need you, or there's maybe elderly family members that need your attention, or other people in your lives that will actually need your attention. So I think our largest job is being a mother to our children, running the household, kind of managing relationships as well too is really important. But also a lot of us will find ourselves in that sandwich, right? Where we're caring for littles as well as bigs, right? As older people, as they're kind of changing in their lives as well too. So there's a lot of challenges, and the problem is that all of these other things we're doing, they actually don't help us on our CVs. They don't help us to go up for a promotion or any of those things. So that's why we wanted to talk about it. So I'm just going to touch briefly on the current landscape, because I think everyone in this room, we know in the reality of our lives, we see it every day, kind of the reality of it. But a few things that we wanted to mention is that despite like the gender parity in medical schools really kind of closing, we have like 50% of women going into medical schools. We actually have not seen that translate into actually leadership positions, and that's unfortunate. So some of the numbers, less than 20% of department chairs are women, and then even more so, like about 16% or so are medical deans, School of Medicine as well too. And then if we talk about like, associate and professor level promotions as well too, we also see a disparity that's there too. Only 34% of women actually make it to the associates. So if you're thinking about it, please go for it. Put that in your schedule, because we need to have us close that gap itself. So we need to promote ourselves and move up so we can start closing this gap. But then also for the actual professor's level, it's only 21%. So that's a huge difference, and it's not saying that we're not qualified, it's just that we're not getting promoted at the same rate. And then of course the pay gap we know is there. If you actually look outside the walls of medicine, they say 82 cents per dollar, and in medicine itself about 84 cents. So over our career, which they say a 40-year career, which is quite long, we'll probably lose about $2 million of that, which is quite a lot. I think all of us want to go on vacation with that instead, or buy that really nice house on the beach instead, and so it is important. And the last thing that I kind of want to just mention is the attrition rate is really important as well to think about, and this is why a lot of women are leaving medicine. within the first 5 years of medicine, they say 1 in 10 women leave medicine, as compared to 1 in 13 for our male colleagues. And then also, it just gets really challenging to kind of think about how that can affect, the rates of promotion and just even like being leaders in our field itself. If we feel like the only choice we have is either to cut down hours or to leave the field together, so it really is a real problem. So kind of in that framework, I wanted to ask you guys, I want to first start with like the clinical realm itself. What are some of the kind of, we're ER doctors first and foremost, so you saw that we kind of started with that. That is why we came into this field. But what are some of the challenges that you've seen as a woman in medicine kind of working in the ED?
I'll go first. With being a woman in the ED, I think some of the greatest challenges are pumping and labor. So some of the least glamorous parts of being a mom. When I had my first child in 2019, the pumping space for us was the communal faculty workroom where everyone was coming in and out of all the time. There was no privacy, no way to lock the door. So that was not a very comfortable space. And in terms of delivery, I had my first child very premature, and with the second child, my doctors advised me to reduce stress in the 3rd trimester. So navigating as the ER attending, how I'm going to do that, how I'm going to talk to our chair about what I needed was definitely challenging as a very early faculty member.
I can echo those same things. My first was 6 weeks premature. I had severe preeclampsia. I was in the NICU for 3 weeks. Similarly, with subsequent pregnancies, had to dial back in clinical work, which I'm, in retrospect, very grateful I did. I think it made a big difference with not having the same complication the second time around. And pumping, too. I was one of the early adopters of the Willow, the wearable breast pump. And remarkably, it's so loud in the ED that I only ever had one patient notice that I was pumping. I was like taking a history, and he was like, "Excuse me, is that a radio in your pocket?" And I was like, "No, sir, it's a breast pump." But I would have to like put it on and change it in the bathroom, which was like disgusting. So I echo those things. And then I think too, just as all women facing, I think it can be challenging dynamics with other members, other consultants, other nursing staff, ancillary staff. Sometimes you just don't get the same level of respect, or you have to be more direct or louder to kind of get the same things done. And if you're too loud or too direct, you get called bitchy. And I think that's challenging regardless of whether or not you're a mom, and something that, we continue to struggle with.
I agree with both of those. I would also add the actual shift times and how you're trying to coordinate things like drop off or childcare or picking them up, or even just getting through your shifts and getting called. Like I had literally a code stroke the other day, and I'm like waiting for neurology to call, and I pick up the phone just quickly, and it's the daycare like, "She's out of Pampers," and I was like, "Why does that need to be a phone call?" But that sort of thing happens. I don't know if that's ever happened to you, but like that sort of distraction, I think, is one thing that happens. Not every single shift, but you're constantly trying to think about the balance between the things that need to get done at home and the things that need to happen on shift.
Awesome. Yeah, so you see some of the themes. Anyone here ever been called a nurse? As I used to be a nurse, I'm like, actually, I used to be a nurse. It doesn't bother me, but I was like, actually, my title now is MD, but I was like, I like to do both, as I'm like spiking bags of fluids and all of that stuff, right? Because I was like, no problem, we could do both. But yeah, definitely, but for a lifetime of that, right, getting called the wrong things or being mistaken, or just having to go back in the room to see the patient because they forgot that they saw the doctor. Right, all those things that kind of eat up our time can really take a toll on our productivity, our RVUs, all the things that we're getting graded for to actually make, to be compared to our counterparts in the ED itself. So it is important to kind of acknowledge this. What about as like educators, or kind of in the realm of like leadership opportunities and promotions? What are some of the barriers that you have, or challenges that you have faced in that area?
I think there's still a good amount of data showing that women are offered less leadership positions. Actually, even that men are offered more earlier on in their careers compared to women when they're junior. So I think just the opportunity, the sponsorship, the coaching on how to apply for positions, how to ready your application could be a large point of barrier for folks who are like, I want to do this, I want to get to this position, and yet I don't have a plan in place for this opportunity, such as becoming a program director or a chair. So I think I see that a lot with my mentees, like people who are in residency and coming out of residency, where they have a particular aspiration to be a leader within the department or within the hospital, and they don't necessarily have a plan to get there.
I would say in terms of academic productivity, one of the barriers I face is just making difficult decisions about my time, how to spend my time, and then feelings of guilt or regret about how I made those decisions. And then finally having the idea that I need to appear like I'm not having those conflicts, like everything is running very smoothly in my life in all aspects. So that's the main challenge for me.
Yeah, I reflect back on my time as an assistant residency director where we had a relatively large team of APDs, some of which were women and some were men. And it was just always interesting to see how certain components of the work would typically be assigned or kind of naturally be volunteered by some of the women in leadership, particularly the physician moms who are kind of always thinking this way. Like anytime it would come up to arrange gifts for the administrators or graduation gifts or be on the wellness committee, kind of that similar to the labor we do at home would sometimes manifest in the labor we were doing in our leadership roles. And then just navigating meeting times, it's challenging when you have to work around childcare hours or being able to pump. There's maybe 7 a.m. on a Friday works for the majority of other people, but depending on your childcare situation, what you've got going on, it may not, always translate to work well for you. And I think, a lot of times it's hard for us to speak up about those things because maybe we feel bad or we don't want to inconvenience other people. But sometimes there's accommodations that can be made for us that don't necessarily, hurt anybody else on the team. And sometimes other people are thinking the same thing because they have their own, issues that might make a particular meeting time or, event challenging for their schedule as well.
Yeah, please, of course.
I was an APD as well, like my first few years. I fully subscribe to the idea of just taking on what's called non-promotable work, meaning work, as you were describing, socials, mixers, even like having meetings with people that were not even necessarily career development based, but just like personal meetings with residents who just are having personal problems. Of course, very important work and also not promotable work. And so just trying to balance out my time and thinking about the concept of trying to make sure that I'm being very focused on the stuff that I say yes to and what the return on investment is. Like, will this actually add stuff to my CV? The second thing that I learned about kind of late is this idea of over-efforting, meaning putting in more effort than is needed for a particular task. And I think that's gendered as well. There's a lot of examples of when you're tasked to do something, yes, like buy a gift for someone, right? Like now you have to find the best gift out there and you want it to be like really, really nice and well wrapped versus like just getting a gift card to Amazon would also be fine too. And so just thinking about that over-efforting, and I think that's gendered.
I was just thinking of one other thing too. I remember with my APD role, there was a lot of recurring meetings during like childcare hours. And so I would have to make shift requests around those. And then that would mean all my shifts were on evenings and weekends, which was really challenging. So being intentional about making sure that I wasn't just only working evenings and weekends. If you do that, you'd never get a break, which is like a sure way to lead to burnout.
And there's also like going up for roles as well too. There's a great book called Confidence Code, but there's a lot of funny in a sad, crying way, by the way. Statistics about like women, you have to be about 80% of the job description before they actually apply for that job, versus our male counterparts will be 50%, right? And you're like, what? 50%, and they're going to apply for that job, and guess what? They're going to get it. as well too, right? And this is the hard part about how we're programmed to like not raise our hands because we're afraid to get the wrong answer, right? All of these things that kind of culturally are kind of propagated throughout as well too. So we definitely see like kind of the promotion and opportunity gaps because of that as well too. And also I think the question that women get a lot is, how are you doing it all? You have kids at home, you have this and that, how are you doing it all? I get that all the time with 4 kids, right? And I'm just like the same way my male colleagues are doing it, right? That was my answer. I was like the same way they're doing it. Right, I'm not going to choose one or the other, and I tend to be a little bit aggressive, I admit, with that answer, because I know you're not asking that to my male colleagues, so why are you asking me that question, right? It's just a kind of an interesting place to be. Now, what do you guys think about, like, let's talk about the home life then, right? That's a 24/7 job. You have to be on at work, and then you have to be on as you're at home as well, too. So, and then also, like, some of the challenges with, like, the roles in the home and kind of the jobs at home that need to get done too can sometimes be a challenge. So what kind of things have you guys faced?
I think division of labor can be very complicated, and whether you're a single parent or in some sort of partnership, it's not always clear cut, like what needs to be done and how to divide it up. And I think without that clear division of labor and assignment of tasks, it's very easy that one person, often the women, take on more of that household work. But I think we don't always think to be explicit about that. So that's one thing. And you don't even realize all the things. I mean, it's housework, it's arranging childcare, it's getting birthday gifts for the birthday parties, it's responding to the birthday invitation. I mean, there's so much of that we just don't even think about. So I've noticed that to be particularly challenging.
Yeah, I would agree with that. I've been reading a lot about actually relationships where the female is the higher earner, because that's how it is in my family. I'm the primary breadwinner, and actually in those relationships, the woman still tends to do way more of the housework, and sort of a weird way to make the male or the partner feel more emasculated. So that's been interesting to learn about, and I think that definitely happens in our relationship.
I think we'll discuss solutions later, so I won't get into that. But one of the challenges, especially for myself, is that I don't live near family. And so I don't have as much of a pool of people to turn to for support. And I know in academics, especially if you work at a major academic center, that might not be near your hometown. And so you're going to have a thinner pool of support. And so we've had to turn to outsourcing, which is an expense, a very large expense on top of regular childcare. So I think the lack of support, and of course it's our choice to be where we are, we're choosing to live here, but that I think has a large effect on the household and getting things done.
Yeah, and definitely I think like as you're kind of, as we're talking about solutions, I think it is important to pause and think about in your own lives, like what are some of the challenges that you're feeling that's making you might feel a little bit burned out, or even if you've ever had that thought about leaving academics, it's good to pause and say, what are some of those challenges that you're feeling in the clinical realm, in the academic realm, but also at home that's making you feel that way as well, because it's going to look different for you. And definitely the household part can also be like the events that we had to plan, Christmas gifts holiday gifts that we have to do, signing the report card, right? My natural thing now, if I get anything from the school, is I forward it to my husband, right? I know it takes me extra time versus just like filling it out, but it's like, there's 2 of us, why does this always come to mom, right, who's working and stuff too? So just trying to also teach our school systems that there's actually more than one parent in the house that would be responsible to help out as well is important. But those are a lot of the challenges that unfortunately that we have to face. And I'll admit, I went on strike like 3 weeks ago from like laundry, food, cleaning up and stuff too, because it's hard, right? You're working full time and doing all this stuff too. So I would recommend, actually it works pretty good for mental health if the house becomes a hot mess, by the way, because that stuff still doesn't always get done. But for mental health, it actually works really nicely for a second, but I had to get back to us. So I want to talk about then, just want to highlight some of the, like, how do you know this is happening, or what are some of the questions that you might need to ask? Because I think sometimes we just accept it, this is the way it is, right? This is the way our life is. We just keep our heads down. I think that's the thing medicine teaches us, keep your head down and work, right? Keep pushing forward, you're gonna reach your goal and that's it. But I think there is value in stopping and taking a step back and reflecting and asking yourself certain questions that might actually help you to decide, do I need to keep pressing forward with the way things are, or should I actually reassess if this is the right path or not? So we'll kind of talk about that a little bit. So the pandemic, I think, really helped a lot of us to slow down. Like some of those meetings, the commute back and forth for that 20-minute meeting now disappeared. So in some ways, there are some gifts the pandemic gave us, but it also still is lingering in the form of moral injury and burnout. And I think a lot of us are still now feeling the effects of COVID now that we have a second to pause and think about what our field has gone through. So in the clinical realm, are there any questions that you guys ask yourself when you're feeling burned out or the moral injury that has helped you to kind of assess how you're doing and if you need to make a change or not?
I normally ask myself, is this a problem that I alone am facing, or do other people feel this way and are also facing the same problems? And that, I think, really helps me because about 100% of the time, I'm not the only one feeling that way. And talking to a colleague can really help validate my experience and help me come up with solutions.
I'd like to ask myself, is there an easier way for this to be done? Or is there a kinder way for this to be done? That was largely surrounded around shift times. So shift times are very important for me because I have 3 kids to drop off at 2 different locations. And so, having a shift that starts at 8 o'clock was just way too stressful because I'd have to try to get my kids out of the house in time. And so just recognizing that was a point of tension for myself. And trying to avoid an 8 a.m. or 7 a.m. shift time and move it to 9 or 10 was just a small shift that really removed a lot of daily repetitive stress for my family. And so just being mindful of what can I do with this situation that's causing me stress to move the stress lower. And sometimes you might not be able to completely eliminate it, but just being mindful of this is causing me stress. There has to be a different way. And sometimes it's also bringing in key stakeholders like the scheduler or your supervisor and saying, there needs to be some other solution. So that was one thing, just thinking about in many different areas, how could I be more kind to myself? Because what I'm feeling right now seems like I'm not listening to the stress that I'm experiencing.
Yeah, those are great examples, and I would echo all of them. I think for me too, it was just looking at what my current roles were and asking myself, where can I consolidate? Where can I kind of focus my efforts? Where can I free up time? And I've always enjoyed being involved in leadership roles, and so asking myself what can I do that's meaningful to me without dramatically impairing my quality of life, and shifting more toward leadership roles that allowed me flexibility. So ones that maybe had less standing meetings or less things that I had to be in places in person for at a scheduled moment, to things that would allow me to pick and choose when I could devote effort. I think gave me a lot of flexibility with my clinical schedule, and definitely made me feel like I continue doing meaningful work without getting burnt out.
Another question I ask myself on shift too is there someone else who can help me do this? I notice a lot with my junior residents and even senior residents that they will do all of the tasks on their own when there could have been a tech or a nurse to help them. And so just trying to teach them, okay, you're going to go put in the ultrasound guided IV because the nurse couldn't get it. Can you go ask them to get the machine and to get the long IVs and all the stuff set up so that you're just going in to do that task and you're not taking 20 minutes running around the emergency department. So just trying to normalize for them, asking for help, recruiting people for help. And sometimes I will do that in front of them just so that they can see, you're just asking for support. And there should be a positive response to that.
I also find it helpful to think about who else is this decision impacting. So pre-kids, I was one of those people that would routinely stay 2 or 3 hours after my shift. I would never get out on time, and it didn't really matter that much because it wasn't really affecting anybody beyond myself. But once I had kids to get home to and a husband to, help care for our children and be there for dinner and be there for things, it all of a sudden, it really made me have to reckon with what was a reasonable amount of time before I called it a day and signed out and left the department. And that was a really big shift for me. And now I really try to set boundaries around trying to leave within an hour of when my shift actually ends. And I found that to be helpful.
That's awesome. Yeah, because I think that those are some of the things that can really kind of infiltrate into our own personal time and our time to actually like spend time with our families, but also like to have time for ourselves, which is the first thing that we're about to neglect is that time for ourselves. And it really is like some of the work, like even like think about like your in basket and your notes and all of that stuff too, and like how can you optimize that as well. And we'll talk about some strategies, in a second, but it definitely is like how can you use your team effectively to actually help you to get things done is really important. And then also some of those like non-clinical parts of like how long is I asked myself like how long is this note taking me? And maybe it doesn't need to be perfect. Maybe it could be good enough to like keep me out of a lawsuit and just get the point across, and that might be good enough, right? To keep it moving, right? And that's where dot phrases and things like that can really help you. So definitely think about that. And we talked about a little bit about leadership. Actually, my mom's a nurse, so I always say to her, she was like, why are you working so much? Because for her, right, you go to work as a nurse, you come home and you're done, right? And that was it. And even though she worked 20 days in a row, right, she's still, and that's kind of where I got my work obsession with in some ways. But still, like, it was clock in, clock out, right? But when our family members see all of us, they're like, why are you working so much, right? And I always say, like, it's not just the shifts. If it was just showing up for the shifts, our lives would be so much so easy. It's all the other stuff that we're doing. So what are some of the questions that you guys ask? And I know you touched base a little bit about, like, your commitments, because we're always told say yes to everything, commit to everything, get opportunities, and grow your career and X, Y, Z. So what are some questions that you might ask yourself to reflect before you do that?
I think it's really helpful. I recommend everybody in this room actually draft a personal mission and vision statement and values. And I know that sounds cheesy. If you want to make it easier, use ChatGPT. You can type some things in and it'll spit it out, and it's a great starting point if you don't like staring at a blank page. But that has been really revolutionary for me, because every time an opportunity comes along, it gives me something that I wrote when I was of sound mind, or maybe ChatGPT helped me write, to like cross-check it against and be like, is this in line with what brings me meaning, with what, the career that I envision for myself? And it makes it a lot easier to say no to things that are not in line with that.
Yeah, I would echo all of what you just said. For promotion, we have to write a statement like that. And I just did that this year, and I thought it was very helpful to like guide my decisions. And it actually helped me say no to some smaller things, which was good practice, was saying no to some bigger things as well.
This is like the most important part of your journey, is just reflecting on where you are right now and where you want to go. So I think I tell my advisees, to think about the repercussions of saying yes and the repercussions of saying no, because a lot of times we impulsively think, I need to say yes to everything. I fully subscribed to that early in my career, that I had to be, help my reputation of being easy to work with, of being reliable, of being dependable. And so I thought I should say yes to everything. And that really drove a lot of fear around saying no, because how will that hurt me? So now I think about like who is this going to benefit? Is this going to benefit me or someone else? Is this actually going to be valuable for my CV? Is this something that's feasible, right? I think about feasibility way more now, because I've been someone, I'm sure you have too, where you've been on a project and the idea sounds really great, and then when it comes to actually moving it forward, all of it falls apart. And so really thinking very early on about feasibility, so that when I'm saying yes to something, it's actually a task that can go to completion.
So we've kind of been talking about like kind of the chaos at work and the chaos in academics itself, but we know as soon as we walk through those doors, right, the true chaos exists in that way with the, meals and childcare and laundry and cleaning and all the never-ending like to-do lists that we have, and even the things that we didn't know were on the list or in the list hiding at the bottom, and we'll find out about them later when we forgot about it. But how do you guys like approach like understanding those barriers and kind of figure out like what you need to change and what you don't need to change?
With home, we've been talking a lot about outsourcing. And I think it's really important to ask yourself, like, what do you actually want to outsource versus what brings you joy to do on your own? As an example, I don't want to outsource all of my childcare. Like, I need to outsource a little of it so that I can do what I need to do and get things done and go to work. But I don't want to outsource all of it. I want to be there for the important moments. I want to know my kids. Like, I want to be the one raising them. And so that's something that I've tried to find kind of the right balance. And with that, I've actually decided to keep them home on Fridays. And I've made the personal decision to like not do any sort of administrative or education stuff on Fridays. If I get scheduled for a clinical shift, I get scheduled for a clinical shift, but otherwise like they're home with me, that's my day off with them. And the rationale for that was because if I didn't do that, I'm already working a lot of evenings and weekends. So that's really my way to like guarantee that I get some, sense of a weekend with them. But that means I have to outsource other things. And when it comes to like house cleaning, I am all good with outsourcing that. That brings me no joy. Other people like it. They get satisfaction from cleaning. I get it. My husband loves to do yard work. I have tried to convince him to outsource that like a million times. He has like a weird amount of pride in his mowing of the lawn. But, ask yourself, like, what are the tasks that bring you joy and what are the things that you're okay with? And because I don't think everything can be outsourced. Almost everything can be, but it's not always good to outsource everything.
I would probably say think back onto the idea of over-efforting. Like everything doesn't have to be perfect. For sure, my house is not perfectly clean regularly, and I think I thought that it needed to be at some point in time, but now I'm just like, like folding the clothes, I just sort of like do like one movement. Okay, it's done. That's enough. And so, instead of making it, like I watch Instagram every once in a while and they have these like boards where you can fold the shirt. I'm like, no, that's just not going to work. So just like lowering my effort and just being okay with like getting the job done versus perfect has been really, 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 really helpful. I also like have my kids get involved a lot. Like my 7-year-old makes her own lunch. I was like, the moment she turned 7, I was like, this is your duty. And so, just like wrapping them into the chores creates a lot of family, I think, responsibility for everyone just to understand that like they're going to one day be independent. The other concept that I learned, actually from our dear friend L.A. Alvarez, was really about self-compassion. Of course, I had heard the term before, but I really learned it from him when he was just talking about how we really need to move towards being kind to ourselves and just recognizing moments where we're causing harm through stress, through pressure, through high expectations of what we're capable of doing.
Yes, I would definitely echo that, especially the lower expectations. So I found that's really helpful with having children in general, just lowering my expectations. Like, this vacation is going to be relaxing was my previous expectation. To this, now my current expectation is this is going to be more stressful. I'm going to be more tired than I am in normal life during this vacation. Or previously, my expectation was when I come home from shift, I'm going to relax. And now the shift is the most relaxing part of my day. When I come home, I'm going to have to make dinner and clean, and it's going to be very stressful. So I find that's helpful when assessing my situation at home, just having lower expectations.
And I think, in the reflecting part is really taking a step back and saying, like, how much is on your plate versus how much is on your family's plate. Like, we use the word family work at home in my house, instead of like mom's work or women's work or whatever it is that our culture is making us do. And especially coming from like an Asian background, it's very much the household has to be clean, right? That shows your worth, that you're controlling everything, that you're on top of everything. And it was just like, that was the first thing to go for me, because I was like, I can't do that and have my career and do it all, right? And stuff too. So instead I have changed the wording to be like, this is household and family work, because I'm not the only one who lives in the house. And when we have those stretches of shifts that we're out for like 9 out of 10 days, whatever it is, right, that could be really challenging. We're not making the mess either, right, is the truth of it. And so I found that like taking a step back to reflect and say like, which parts am I responsible for, but which parts should the family be responsible for, has helped. And having those conversations too can help me to like just assess the barriers that exist there, and then really come up with a solution, which is our favorite part of this, is really thinking about. And we really want to just say like, one solution, you'll say we'll give like multiple solutions for all of these categories, because your own personal journey and the barriers and challenges that you face will be different from even the person sitting right next to you. And so that's why it's really important to kind of think about like what would work in your life and in your situation itself. And my 14-year-old, I love what she says. She was like, don't let perfection get in the way of progress, right? And she always saying that, and I was like, can't help it, I'm a perfectionist, right? But this is the way we are. But just really thinking about like the solutions that we can do that can get you closer to your goals, right? And it doesn't have to be the perfect solution, but if it's good enough, then that's moving forward. So in the clinical realm, we'll kind of jump back there. We do a lot. We get our patients like blankets and all of this stuff, and glasses of water. Duke gives out gold stars for great clinicians who do that, who give excellent patient care. Guess who gets the gold stars? It's our male colleagues, because we're expected to do this, right? This is just part of our job, right? And so it's kind of a funny thing, and I actually asked for the data behind it, and they told me they didn't have it, and they also stopped giving out gold stars as well, too. I don't know if that was good or not, but anyway, just to say that like some of the work that we do sometimes is underappreciated, but thinking about like the solutions in the clinical realm, what are some of the kind of strategies that you guys have to kind of fix some of these barriers that we've talked about or challenges that we talked about?
Just to go back to the pumping example I gave, I think this issue really came to a head in our department when we got an email that we were no longer allowed to pump in this communal room from an administrative assistant. And I think all the females responded very negatively to that. And they actually were forced to have us design our own pumping room. They took over two people's offices because of the response. So that has been very helpful in creating a safe space for women to pump. And then in terms of the preterm labor, actually some of my colleagues really presented the data that female physicians have higher rates of both preterm labor and miscarriage. And we now have a rule that females who are pregnant, who are attendings, don't work night shifts during their first and third trimester. So that was very helpful sort of structural changes that we made within our department.
Yeah, we are really fortunate to have a director of gender equity, Dr. Klikowski, in the audience. And her role actually came out of one of our faculty retreats. A lot of the women were speaking up and saying, hey, like, there's a lot of disparities here. And it was really great to see her department actually, like, supporting her role. And she's done a lot of amazing work, advocating. And I find it's just like, and the theme of the last session was bringing data to your department and organizing groups who can work collaboratively that include different types of stakeholders to develop these policies and borrowing policies from places that have them to kind of show that this is the way and this is the movement has been excellent. And then for me personally, I think a lot about documentation. I've had to really shift my workflows around that to be able to facilitate getting home on time and just to avoid signing notes, sucking up all of my time outside of shift. And a couple things I've done is just aggressively tried to sign notes on shift. Like anytime I'm not actively doing a patient care thing or staffing, I'm signing my notes from the shift before. And then also really, I was always terrible as a resident about dictating on shift. I would end my shift and have like 20 notes that I hadn't started. And now I take 5 minutes every time I see a patient on my own, and I just do the dictation or write the note, and that cognitive offloading has been great. I have so much less anxiety leaving shift with my notes unsigned as long as they're mostly done, and I don't have to keep all that in my brain because I've brain dumped it. So that's been really helpful.
I definitely chart while I'm talking to my patients, and that has been really helpful. I really hate charting at home. I don't think I've charted at home in years. I try to finish my chart when I leave my shift, or if I'm working the next day, I might just do it right before the person's able to sign out. I'm just like, okay, let me just do a couple old charts. But I really try to avoid charting off shift, because it's unpaid. I'm not getting paid for that time. That feels crazy to me, just to be doing it while I'm not getting paid. So I try to make sure I finish my charts on my shifts. The other thing that's really been helpful for me is just thinking about my shift timing. So I like to work days during the week and then evenings during the weekend so that I have time with my kids, similar to your point. On Saturday, Sunday, when they're at home, I'm home with them. And I feel like it's less of a challenge to leave at 5 p.m. because they're sort of starting to wrap up their day than it is to leave at 9 a.m. when they're awake and they're like, Mommy, how come we have to go to work? So I try to avoid hearing, Mommy, why do you have to go to work? And so that helps when I drop them off at school and then I go to work. They're not even aware that I'm going to work, and then I kind of swing around and pick them up at the end of the day sometimes. So that helps, but I'm very thoughtful about when I work the shifts, the shift times, and how I make my requests.
Perfect, awesome. Yeah. So And I think like one of my quick strategies, I like to go into the room with the residents, so they get to examine the patient. I could give directly observed feedback on them, but I also can be there. I always say like, I'm your scribe, so I'll do the quick HPI and physical exam, but I also know I don't need that in my notes because it's done. So all I need to do is my MDM and I'm good for that as well too, so it kind of helps with the workflow. Or I do charting rounds. So after I run the list with my residents, I'll sit down and force myself, and I literally have to force myself to be like, I need to start notes on all these patients. And I do my charting rounds and just run the list and make sure I have a note started on all of those patients as well. And then once I finish that, then I'll do some teaching as well. So just trying to balance the work and the teaching instead, of which we always flip-flop, and then we end up having 20 notes to do at the end of the shift, which is not helpful. What about with like we talked a little bit about saying yes to everything, and what about like the promotion gap and pay gap, and like what are some strategies for like combating the opportunity gap that exists?
Definitely to build a personal board of directors, so people around you. When I was an APD, I really wasn't doing anything productive beyond just like working with the residents. I mean, I was productive, I'm helping the residents, but I wasn't doing anything that I'm adding to my CV other than that line of APD for some number of years. What really, really helped me was creating a network of people who were productive and just sort of like joining in on their energy and combining. So one of the things that I joined, actually that's how I met Shri and Mary, was academic life and emergency medicine. So it's a community of practice of like-minded individuals who really want to help shape medical education. And so learning from this idea of joining a community of practice there, I've joined a lot of other communities that are interested in similar things. So just really building out a network of collaborators has really helped with getting publications, with getting speaking opportunities, and that has helped my career.
I think the community piece is so great, both for academia, but also just life. We actually have an amazing group chat of physician moms that's just grown and grown and grown. And it used to be just emergency medicine, and now it's all different specialties from across the institution. And it's just incredibly supportive to have like a local group of moms. It's not like the crazy Facebook mom groups where people are just like off the deep end, because it's like, normal people that you have some connection to. But I found that incredibly helpful. And I totally agree with the board of directors. I think one of the things I've noticed, especially as I've gotten more senior, is that I have a lot more mentees, but a lot fewer mentors. It's like really hard to have people looking out for you as you advance, because people move institutions or they retire or they move on. And so being intentional about making sure you know who's in your corner, who's a sounding board for you. I actually have a coach who I started as like, I was paired with him because he was training to get like certification, and we've just kept our coaching relationship, so I don't have to pay for it, which is incredible because I think it's really normally very expensive. But he is in a different department, but still within my institution, which is really nice because he's both has contextual understanding of what I'm dealing with, but also is like slightly removed. And just having him to bounce ideas off has been really helpful. So I would recommend if you could get somebody to coach you. And honestly, it might be worth the cost. I know there's also virtual, coaching, and people in emergency medicine who have now become coaches who are like eager for clients. So I would strongly consider that. And I know some people CME, or their particular contract or package will cover coaching as well. So that's something to think about.
On the topic of mentors, I agree with what both of you have said. I've recently been embracing like peer mentors, which is something, it's similar to the ideas both of you said, but when I first started, I always thought my mentors had to be more senior to me, but I found that actually people who are maybe a year below me or just 1 year above me can offer a lot in terms of specific skills for research and opportunities. Like one of the teaching opportunities I got was through someone who was a year below me in fellowship. So keeping those relationships intact and not just thinking that your mentor has to be someone who's a whole level above you has been very helpful.
Yeah, or in your own institution at all, right? This is why we have like SAEM and cohort and all those groups, and even like look at each other in the room. You could be peer mentors for each other, right? Is building your network so that you have someone that you can talk to about these things and get a second look can really make a big difference.
Can I add two quick things? One is as I'm moving my career above where, I guess I'm probably now more mid-career, I feel like I need actually less mentorship and more sponsorship. And so I'm looking definitely more towards who would nominate me for an opportunity, who's going to like help sort of push me along. And then the other strategy that I would just share is learning how to draft your own letters of recommendation. That just really lowers the threshold for someone when you're asking them to nominate you for something, offering to draft your own letter of recommendation.
I definitely want to open it up just for if you get any questions out there, just in the last like 2 or 3 minutes that we have. Yeah, please.
I'm Shoshana. I'm a senior resident at the University of Michigan and one of Mary's mentees, actually. My question is, as somebody who doesn't currently have kids, but wants to have them as a fellow or as an attending, do you have any advice on what to ask for or what to specify when negotiating your first attending contract or even subsequent attending contracts from the standpoint of a physician mom? And if so, like, are there like 1 or 2 specific things that you say, like, make sure you advocate for this when you're looking at jobs?
To be quite honest, I was recruited from fellowship, so I can't answer your question directly, but I would say this is the perfect time where you would have a personal board of directors you would go to, because you'd want someone who's been in your institution for long enough, or they were there and then they've left, but someone who's familiar with the dynamics of your chair and who understands what is possible there. And maybe you could have some people who are not as familiar too, but you'd want to go to a collection of people for something as important as a contract and get advice and say, this is what I'm asking for. Do you think I'm missing anything, right? Like, should I be asking for more CME? Because when I travel, I need to pay for childcare, and that's not taken into consideration. Or asking about leadership training, because you're coming in to take on a new leadership role and there isn't really a mentor available for you. So maybe you want to have within that package a leadership course that is covered, or even like a personal coach. But I would definitely, no matter what you're asking for ever in life, if it's a big decision, go to your personal board of directors and say, this is what I'm going to be saying to someone tomorrow. Am I missing anything?
Yeah, because a lot of times we think in academics there's no negotiation. There is. There's a negotiation. It may not be actually the salary part of it, but it will be like the buy down of shifts. It'll be about the resources. And I'll say I did that after, as a new grad, actually coming out and doing some negotiations for it just because of my expertise in the area of interest. So you can negotiate shifts. You can negotiate like help with the administration to help you like as a administrative assistant for like scheduling things that might be helpful. So some of those things you could definitely find leverage, and then even like sponsorship for like taking courses and travel expenses and things like that you might be able to leverage. But it really is figuring out how can you advocate for yourself in a respectful way that kind of promotes what you're doing and is showing how it will actually align with the stakeholders and what they want as well too, right? So that's kind of the important thing. Yeah. Yeah.
Megan Berry from Brown University. Thank you so much for an incredible talk. 2 of you touched briefly on challenges about how our specialty does not make it easy to have healthy pregnancies and babies. I would love to hear your experiences on how you approached your chair, or if you feel comfortable, what specifics you had to ask for in order to have a healthy pregnancy and baby. Thank you.
Sure, yeah, I'd be happy to speak to that. I think the most important thing is to just like know your rights. And most departments will have an HR person independent of the chair, and most of them will have written policies. So you can ask that person to spell out like what is available to you, because the chair honestly may not even know the intricacies of that. So I think consulting that first. With my second pregnancy, after I had the preeclampsia and everything, I was in a very fortunate position because my husband's also an emergency physician. When I hit 28 weeks, he started working my shifts for me. Luckily, it was December, so like everything else stopped. So he didn't really have any other meetings, but he essentially worked both of our FTEs for the month of December. This time around, it was hard. It was hard on him. And this time around, but honestly, that helped. I made it to almost 37 weeks. I had gestational hypertension, but never developed severe preeclampsia, and I didn't have any NICU time. So I'm convinced that it made a big difference. This time around, I have like decided to stop working at 28 weeks, and I've like discussed that. It's scary to ask your OB, like you feel guilty, you feel bad, but I also realized that if I wasn't proactive about it and I got pulled off at the last minute due to development of a complication, it was actually going to screw my colleagues more. It would be better for those shifts to get planned on people's schedules than to have to activate all of the backup. So this time proactively, I'm not going to stop working at 28 weeks. And actually, if you've worked at our institution long enough, you have a benefit of extended paid sick leave. So I was able to take that additional leave paid. And I think I didn't even know about that, but I was talking to a mentor in a different department who also had complications with her pregnancy. And I was telling her, the last time when I started to get high blood pressure about what was going on. And she was like, listen, you need to know that like you're entitled to this and you need to advocate to get this benefit. So had it not been for her telling me about it, I wouldn't have known. And that's another plug for having communities of people that you can consult, because more than likely there's somebody else who's been through this and can give you advice.
Yeah, and data speaks to our administration as well too. So sharing the data makes a big difference. And then also we need to be advocates for our residents as well, and our students that are on as well too, for like pumping and all of these things too. I take the residents like phone. I was like, leave your phone with me and go pump. You don't need to be answering consults and all this stuff, because I know what that was like having 2 kids in residency, and that was stressful to be able to take care of my children as well as work So I think we can be advocates and amplify each other and allies for each other by kind of sharing like the norm is not the way it is right now, but we can make that difference as well too. So. I think we're almost out of time, but we'll take this last one. Sure.
Oh, thank you. Hi, I'm Marnoush. I'm a second-year resident. I don't have a kid, but I plan to have a kid next year. And I was wondering if there are resources or books or anything that you wish you had read, or something that you think it would help to prepare better for doing like both of these full-time jobs.
One book I heard of but stole the idea from, but have not actually read, is called Fair Play. I don't know if anyone else has read that, but it's about splitting up household tasks, and it focuses on that each partner should have ownership of a specific task. So oftentimes the female is left to organize and oversee everything, and then the male is doing what she tells them to do. So this book is about sort of turning that around and saying, you are in charge of the car, everything related to the car, remembering when to do the car registration, fixing everything wrong with the car, and never involving me at all. And that's your job. And sort of splitting up the tasks like that. And I did that recently with my husband. I think it was really helpful and took a lot of stress off of me.
Awesome. Well, I think we're out of time. Thank you guys so much just for the interaction and just the ability to kind of share, because I know our lived experiences are very different, but hopefully we gave you a little bit of strategies to kind of approach these things as you come up with them. So thank you so much. We'll be up here if you have any questions.